Hi, it's Mike Keenan from KM Fitness of Manasquan. Our clients come to us with a whole host of medical conditions, not necessarily diseases, okay? And metabolic syndrome happens to be one of them. It's not a disease, it's a condition, similar to type 2 diabetes, hypertension, high cholesterol, other diseases that are really brought on by poor diet, high stress, overexercise, lack of sleep, and sometimes lack of exercise. So let's talk a little bit about metabolic syndrome today. The target tissues that are affected with metabolic syndrome is typically the thyroid gland, and people come to us with hypothyroidism. But is it truly the thyroid that's the problem? Let's kind of look at it from a different perspective. Let's say you're on a very low-calorie diet. You're really not sleeping a whole heck of a lot, and you might be over-exercising. Okay, so let's start with nutrition, stress, which could be exercise, lack of sleep. How does this affect the adrenal glands? Okay, the adrenals are responsible for a couple significant hormones, things like epinephrine, norepinephrine, okay, and they also are the site of human growth hormone, testosterone in women, and so forth. So there's a lot of different roles that the adrenal glands play, but they can get very, very fatigued if they're not getting the proper amount of nutrition. And they run basically on glucose. So if you're on a very low carb diet for a prolonged period of time, it can affect your adrenal glands. So when the adrenals get fatigued, they can't continue to handle that stress or that amount of pace. So they'll talk to the brain. And the brain will say, I know what you mean, I run on glucose as well, and I'm not getting a sufficient amount either. So the adrenals say, if we can't continue this, what are we going to do? The brain says, I'll take care of it. Reading through the hypothalamus, a signal is sent to the pituitary glands. And the pituitary glands respond by decreasing the amount of thyroid-stimulating hormone. When that hits the thyroid, it starts to decrease the production of T4, which actually becomes active T3 in the body. And T3 is required to run the metabolic machinery located in the cell at the mitochondria. Okay. So we've spoken about the thyroid producing T4, which becomes active T3 in the body, and T3's target tissue is the mitochondria of the muscle cells, or all the cells of the body, quite frankly. Now, in a high-stress situation where the body's trying to slow things down because of high levels of stress, lack of nutrition, lack of sleep, T3 will actually turn to something called RT3, which is the exact opposite. It starts to slow down the metabolism of the body. Okay? So when that happens, you feel tired, you feel fatigued, you might feel cold, and you have a difficult time losing weight. So when people come to us and say, you know, when I was younger, it was very easy for me to lose 10 pounds. I could lose 10 pounds in 2 weeks. What's the difference between then and now? Well, what has happened is you've really had some type of mitochondrial dysfunction. Your body's no longer able to produce that speed of metabolism anymore because you've destroyed your metabolic machinery. So when people come to us, and Susan and I tell them, you're not going to see any significant change for 60 to 90 days, they look at us like we're crazy. But the truth of the matter is that until that machine is rebuilt, you can't start burning fat at an accelerated rate. Let me give you another example that I use. We're in the town of Manasquan right now, about 50 miles south of New York City. If you got in your car and had to drive those 50 miles, and let's just say your car got 10 miles to the gallon, and you had two gallons of gas in your gas tank, are you going to make it to New York City? Probably not. Not unless you get out and start hitchhiking. So if your car is unable to get you from here to there on 2 gallons of gas, how do you expect to eat less, exercise more, and achieve your goal? It's just not going to happen. So let's recap here. Is the problem really at the thyroid? Well, unless you have cancer or some type of thyroid disease, it probably isn't in the thyroid. If we trace it back to the fatigued adrenal glands because of lack of sleep, high stress, poor nutrition, you can see how it would cause your thyroid to become dysfunctional. So what are we going to do to make changes? How are we going to go about changing this? Well, obviously Susan's going to address your nutrition. We're going to teach you how to exercise properly. Sometimes we may be teaching you to do relaxation exercise to allow your body to recover. Sleep is very, very important in this component. What you don't know is while you're sleeping, the cells of your brain actually shrink slightly, allowing an increased flow of cerebral spinal fluid to travel through the brain, and it kind of backwashes your brain cells, for lack of better terms, lowers the toxicity, and allows your brain to function better while you're awake. So sleep is an integral part of this program. If you have any questions or concerns, Susan and I are here to meet you at your needs. Give us a call, and until next time, we'll see you. Bye-bye.